Students, welcome back. In this session we are going to discuss about arches of foot. The bones of the foot are so arranged that they form a series of arches. So there are two longitudinal arches. One is the medial arch and the lateral arch. Two longitudinal arches and one transverse arch. So this is the transverse arch. Okay. So now we will see what are the components which forms the medial arch, lateral arch and the transverse arches. Okay, so the medial longitudinal arch, so this one is the medial longitudinal arch, is formed by from posterior to anterior. What are the bones involved here? So the calcaneus, talus, navicular, medial, intermediate and lateral cuneiforms. Medial, intermediate and lateral cuneiforms, and medial 3 metatarsal bones. Medial 3 metatarsal bones. So all together forms the medial arch like this. Okay, so all the cuneiforms, navicular, medial, intermediate and lateral cuneiforms and 3 metatarsals. This forms the medial longitudinal arch. Okay. The arch rests posteriorly on the tubercles of the calcaneum and anteriorly on the heads of metatarsals. And the summit of the arch is formed by the talus. Okay. Medial part of the superior surface. Okay, and the posterior formed by the calcaneus is S steep slope. Okay, like this, S steep slope, and the anterior pillar formed by the navicular cuneiforms and the bases of the medial 3 metatarsals and ending in the heads of the same metatarsals is in a gradual slope. Okay, so this is about the medial longitudinal arch. Now we will see lateral longitudinal arch. The lateral longitudinal arch is formed by, so here this is the lateral one, the calcaneus from posterior to anterior, calcaneus. Next comes the cuboid and lateral 2 metatarsals. Lateral 2 metatarsals forms the lateral longitudinal arch. This arch rests posteriorly on the calcaneum and anteriorly on the heads of the lateral 2 metatarsals, and the summit is formed by calcaneo-cuboid joint here. Calcaneo-cuboid joint forms the summit. Okay. Here the posterior pillar formed by the lateral part of the calcaneum is short and has a sharper decline than the medial arch. So medial arch will have a slope like this, but on the lateral arch it is not like that. It is somewhat lower than the medial arch. Okay, so the anterior pillar formed by the cuboid and the bases of the metatarsals and has a far shorter gradient, and still this is shorter than the posterior aspect. So this is about the formation of medial longitudinal arch and lateral longitudinal arch. The lateral longitudinal arch is much flatter than the medial arch. Okay, and this can be observed when the foot rests on the ground while standing. Now we will move on to the transverse arches. The transverse arch is best marked in the middle of the foot. It is best marked in the middle of the foot, and it is formed by the cuneiforms. So here this is the one, and it is formed by the cuneiforms and cuboid and the bases of the metatarsals. heads and the bases of the metatarsal heads. Okay, and at the level of the metatarsal shafts, the metatarsal heads, the arch is flatter. The arch is flatter. Okay. And however, the formation of arch is shown by the fact that the heads of second to fourth metatarsals bears less weight than the heads of first and fifth metatarsals. Okay. So the medial and lateral longitudinal arches form the pillars of the transverse arch. Okay, these are all about the formation of arches, and we'll see what are the factors which are maintaining these arches. Okay, here we can see the factors which are maintaining the arches. So this one is the lateral longitudinal arch and this one is medial longitudinal arch. So first factor is the bony factors and second one is the ligamentous factors and third one is the muscular factors. The bony factors are the shapes and sizes, location and positions of various bones on the foot along with the configuration of the articular surfaces play an important role. And also the talus contributes significantly in the maintenance of the medial longitudinal arch by acting as its keystone. The positioning of the talus at a level higher than the rest of the tarsal bones are important. Okay, if you see the ligaments, okay, mainly the ligaments helps in preventing the flattening of the arches. Okay, so when weight falls on the subtalar joint and the maximum strain felt at the calcaneo-cuboid joint. Okay, calcaneo-cuboid joint. So therefore, it is necessary that the talocalcaneo-navicular and the calcaneo-cuboid joints are reinforced on their inferior aspects, and these are reinforced by the long plantar ligaments and the short plantar ligaments. And also the plantar aponeurosis also plays an important role by connecting the anterior and posterior ends of the longitudinal arches. The other ligaments of the intertarsals, okay, ligaments of the intertarsals also including short intertarsal, bifurcate and interosseous talocalcaneal ligaments, etc. And also tibiofibular syndesmosis, which includes the transverse tibiofibular ligament, also helps in maintenance of the arches, and also transverse metatarsal ligaments. So these are the transverse metatarsal ligaments also helps in the maintaining of the arches. Mainly the ligaments which are surrounding the different joints of the foot on the inferior aspect plays an important role in maintaining the arches. Simply we can say like this. And muscular factors, here the tendon of tibialis posterior, here you can find, so it's a big tendon, tibialis posterior, and the tendon of peroneus longus, so these are the two ligaments passing under the cuboid acting as a sling for the lateral arch. Okay, and also here we can find this tibialis posterior tendon. Okay, very clearly. So this one is the flexor hallucis longus tendon. This one is hallucis longus. This one is tibialis, tendon of tibialis posterior. Okay, and also tibial is anterior. So tibial is anterior and peroneus tertius pull upon the medial and lateral borders of the foot from causing the elevation of the respective arches. And also the long flexor tendons acts as an tie beams to the longitudinal arch. So the muscles of the sole, here you can find the muscles of the sole also help to keep the components of the arches in position. So these are all the factors which are maintaining the arches. Thank you.